L4, L5 disc herniation. This is my personal story. Imagine you wake up severe pain, severe back, severe leg pain, and before you even get out of bed, you're having trouble. You know it's going to be a bad day. It's like your back is stopping you from doing all the things you love, even your job. This story isn't just a theoretical one. This actually happened to me. I'm a chiropractor. I improve alignment of the spine, take pressure off the nerves to relieve pain and improve human performance. But yet, I was in big trouble. I had a bad injury in my back, a disc herniation, and it was really bad. A severe pain in my leg. Despite all this, I got better after a year. I'm fully recovered, went back to doing everything like I did before the pain. My experience taught me a lot, and I want to share that with you. If you're going through terrible back or leg pain because of a disc herniation, I know it seems like it's not going to get better. I know you have dark periods that you're thinking about, but I'm going to tell you, I'm living proof that you can get better without surgery. This video is all about giving you hope and showing you that getting back to a pain-free and highly functional, high-performance life is possible. Not only am I going to share you my personal story of how I recovered from this debilitating pain from an L4, L5 disc herniation, but I'm going to outline the exact steps I took to fix my disc herniation and get back to a normal life again. Let me give you an example today, all right? This week, what have I done? I'm bending over and I'm adjusting spines. This week, I trained in martial arts, kickboxing, wrestling. I lifted weights. I did chin-ups. I did push-ups. I'm doing one-legged deadlifts. I did leg work. I'm back to where I was. By following the steps like I tell you, I believe most of you, 95%, can get back to being pain-free, and not just pain-free, but highly functional, high-performing body. Keep watching to learn more. I'm Dr. Gregory Kramer. I have over 33 years of clinical experience. I'm certified in chiropractic biophysics, which is the leading corrective care technique in the chiropractic profession. I specialize particularly in chronic degenerative disc problems. Degenerative disc, bulging disc, herniated disc. I also take care of spinal ligament injuries from auto accidents and sports. My main mode of treatment is CBP protocol, which is chiropractic biophysics, which is mirror image adjustments, mirror image traction, and mirror image targeted corrective exercise. And we love using spinal decompression, non-surgical spinal decompression for people with any type of disc problem. That could be a bulge or herniation or a degenerative disc. Now, before I continue with this video, I need you to hit the subscribe button. You know what to do. Like and subscribe. If you want to learn how to relieve pain, stabilize your spine, avoid spinal surgery so that you can live stronger, longer, pay attention, and like and subscribe so we can share it to people that need this information. If you're suffering with back and leg pain from an L4, L5 disc herniation, I want you to know that I understand what you're going through. I'm not just saying that. I went through that about a year ago. You see, about a year ago, about last February, a couple days after a very hard training session, and again, I'm twisting, doing martial arts, I'm lifting weights. I woke up kind of in the middle of the night with burning pain in my back. This is unlike something I've ever had. I've never had a disc problem. I've never had chronic pain, and I'm an old guy, and I've been training my whole life. I had burning pain going down my leg. In fact, I went in the clinic that day, and I had one of the doctors in my clinic take an x-ray. I could barely stand for an x-ray. I was in bad shape. I went to a chiropractor, and I had some treatment, very gentle. I was still doing bad. The next day, I was still in bad shape. I couldn't even drive. Went to the same chiropractor, but this time I was so bad that by the second or third day, I'm lying on a football. In fact, I had to sleep face down over an exercise ball for about a week. In fact, when I was transported in the car, I had to lie face down on a minivan over an exercise ball. That's how bad I was. When I waited in the chiropractor's office, I was face down over a football. I couldn't stand, I couldn't walk. Now, usually people can find some position of relief. I've had patients carried into my office. Again, I've been taking care of disc problems for over 30 years. I've seen over 200,000 office visits. But I never had anybody that had no position that was comfortable, and that was me. And then very simple, you know what happened? I went and had some spinal decompression. It felt good, all right? The next day, I could not handle the decompression treatment again. I was so inflamed. So what did I do? I needed an MRI. I needed to get more information. Again, I was in such bad shape that I had to be knocked unconscious to get an MRI. And while I was waiting in the hospital, I could not sit in a gurney. I had to lie face down on a gurney to be transported in the hospital. And the hospital was so backed up because it was apparently there was a snowstorm and there were auto accidents and they had to use the MRI. I had to stay overnight. But there was no position possible for me. Can you imagine being in a hospital? No position. And this is after they pumped me full of drugs. So the only position was possible was lying face down over a football. And sadly, in that hospital, I was so paranoid. What if my football breaks? I'm out of luck. And they did not have an extra one. So what I did was I had my wife go out and get me a second exercise ball. How crazy is that? Here we have these $1 million hospitals and no one had an extra football. So again, a couple of days, some serious drugs. I was knocked unconscious. I had an MRI. It was a huge disc. And now what? Do I need surgery? All right. So I contacted another doctor of mine, and very simple, we had a conversation, and I spoke to a couple surgeons, and I didn't think I did. The surgeon didn't think I needed surgery. I was already in the hospital. And within a couple days, the inflammation calmed down, and guess what? Now I was able to get some proper treatment. Now I could stay on a corrective program which consisted of spinal decompression. Spinal decompression saved me. You feel safe when you're in spinal decompression. It takes pressure off. It's soothing. In fact, you fall asleep most of the time. So again, the first time I tried decompression, I was okay. The second time, I couldn't tolerate it. I was too inflamed. So the moral of the story is some of you might need a week. Some people might need to buy time a week. You might need to lay around the house for a week. You might need to take some meds. You might need to ice yourself. But most of you are not going to need surgery. So I got comfortable and I found someone that was an expert in spinal decompression, and that saved me. And I was under decompressive care for about 3 or 4 months. And within a week, I was back to work. Not great. I slowly followed all the exercises that I recommend to you. I was walking a couple times a day. I wore a brace. I didn't lift anything below my knees. I did the spinal hygiene exercises 2 to 3 times a day. I was getting spinal decompression 3 to 4 times a week. So again, and each week I was able to do more. Within 1 week, I was back in the gym. Now, don't get me wrong. Just because I was back in the gym, I'm not deadlifting. I'm not loading my spine. But I could do chin-ups, push-ups, dips. I could do machine where I would put a pin in, and I could do pushing, and I could do pulling exercises. I've outlined this. Look at all of my videos, and I outlined the timeline. So the key thing is, number one, you got to make sure it's safe. So you got to make sure you go to bathroom every day, and you are cleared by a physician. You have no emergency. That means you're not getting severe weakness. You're not losing control of your bowel or bladder. But I'm telling you, the spinal decompression saved me, and that's what saved many of my patients. And then as time went on, I was able to do more, okay? I stopped doing any type of sparring where it was high speed for, I think I waited approximately 3 or 4 months. But I was walking every day. I was riding a bike. I was gently lifting weights in safe positions. I was doing core exercises, cat camel, all the things I showed you to do. And guess what? I am back to where I used to be. In fact, I've had some new strength goals. Is it a straight line up to the top? Well, not exactly. For me, I was doing better. I had a couple flare-ups. Of course, almost everybody will have a flare-up. Why? I did too much too soon. And it's always the case. Even too much proper spinal hygiene exercise. Too big of a jump, it would flare me up for a couple weeks. Okay? And I had a couple of those over the course of the year. And this year, right around December, I had a flare-up, and that affected a different level of the spine. But within a month, I was back to where I was. And it wasn't a bad flare-up. It was enough. It didn't interfere with any of my weightlifting. It didn't stop me from doing the martial arts or kickboxing drills or the stand-up grappling or any of that stuff. However, I've had a couple flare-ups, so expect it. And I tell patients, listen, don't get overly excited on your good days. Don't get overly depressed on your bad days. You're going to have good and bad days. But over time, you're going to have more and more good. You must follow the program. You must be on anti-inflammatory diet. You must be doing your exercises twice a day. You must be walking. You must be learning how to do a hip hinge so that you're not loading the disc. You must be getting spinal decompression, non-surgical, if it's correct for you. Everybody's different. And you must be in the right position. Not everybody's the same. Some people get decompression on their side. Some people's face down. Some people it's face up. Now remember, I have a whole video on spinal decompression. So watch that. I have several videos on how to rehabilitate. So again, in my office, we use spinal decompression. We're going to test you with x-ray, motion x-ray, and probably an MRI. We are going to pre-test you. That's pressure test. We'll put you in different positions to see, does it feel good? Or is there a better position? Okay. We will then transition you from spinal decompression to spinal corrective care, where we work on alignment. So we have a long-term solution so that disc problem doesn't keep coming back. Okay. We also target the exercises that are best suited for you. Now, there are some complications. When you have a disc problem, it affects the nerves. One of the complications is many people over time can start getting some neuropathy. That's numbness, burning, tingling, pain, cold, hot toes. So neuropathy usually starts in the feet. Sometimes you can get it in your hands. And there's a couple factors involved. And I started to get a mild case of it. That's doing better too now. And the next few videos, I'll start sharing with you the causes and symptoms of what neuropathy is. But in general, neuropathy or peripheral neuropathy is a problem with the nerves at the ends of your body, like your toes, most likely, and then also your feet or your hands. And typically, neuropathy signs are pain, numbness, burning, or cold, or hypersensitive, or ache, okay, or feel like your feet fall asleep. And I'll be talking more about that on the next video. Now I want to hear from you. I've told you that I've gotten well with decompression and corrective chiropractic, and I've helped thousands of patients get well with decompression and corrective chiropractic care. But I want to hear from you. What have you done? Has your disc got better? What have you done? Have you done spinal decompression? Have you had surgery? Have you had traditional chiropractic, which is different than corrective chiropractic? Do you receive spinal adjustments, mirror image exercise, mirror image corrective traction? What have you done? Have you failed? How many surgeries have you failed? Was it a laminectomy? Was it a fusion? How many levels? I want to hear it from you and see what's going on. Now remember, be sure to like and share this video. I want more and more disc herniation sufferers to know that there's hope. If my story can help inspire them, then I know this video will serve the purpose. Please like it and share it, okay? Chronic pain from spinal ligament injuries is the #1 cause of pain and disability. Also, subscribe to my channel now if you want to learn more tips how to eliminate pain, stabilize your spine, avoid spinal surgery so you can live stronger longer. And the next video that you should watch is the one if you want to learn easy and safe exercises that can help you get rid of pain from an L4-L5 bulge or a herniation. Go watch the next video.